Thanks everyone for joining this morning/afternoon, depending on where you are. Going to share my screen. Can you give me a thumbs up if you can see that? Okay, perfect. Great. Okay, well, I am an assistant professor in community health and epidemiology from Dalhousie, and affiliate scientist with Nova Scotia Health and IWK Health. And what I'm going to focus on in the few minutes that I have is finding meaning on the tenure track. And I'm going to walk you through the development of my research program, which is an action-oriented research program on gender-based violence. So, just to start off, a little bit more information on who I am. I lead a diverse team of researchers, community leaders, and advocates, service providers, decision makers, trainees, and women with lived experience of violence who are all committed to research and knowledge mobilization that strengthens systems and structural responses to violence against women and gender diverse people across the country. We have a website which outlines all the different projects and outputs that have been created through our work, whether peer-reviewed or infographics, lay reports, video summaries, and more. So I encourage you to check out that website if you're interested in learning more about our work. But I think that is a key piece of how we operate within this partnership-oriented and embedded research space is really trying to make all of our outputs as accessible as possible. All of our peer-reviewed publications are also published open access with that in mind. But I'm going to tell you a little bit more about how I got here. But before I do, I just want to emphasize why this issue is such a critical health issue within women's health and gender diverse and non-binary health research. So, intimate partner violence, or IPV, is the most common form of gender-based violence around the world. What you see here are the prevalence estimates of physical and sexual IPV among women based on World Health Organization region. And the really key feature of this figure is that whether we're looking at low, middle, or high income regions, IPV is highly prevalent around the world. It has critical consequences for women's health. In fact, with the recent Global Burden of Disease study published a few days ago in The Lancet, they highlighted that IPV is one of the top 5 health risks among reproductive age females globally, and that comparatively it has received much less resourcing and policy attention than other major health issues. So, my research program is focused on advancing systems and structural responses to interpersonal violence, with a particular focus on violence against women, or VAW, and gender-based violence, or GBV. And in particular, I focus on response at all levels of prevention, whether we're talking about primary prevention, preventing violence in the first instance, secondary prevention, preventing violence from reoccurring, or tertiary prevention, preventing the negative health outcomes of violence. And within this program, I have 2 streams of work. One that's focused around theory development, so understanding the major causes of violence and how we should measure these burdens of violence, which ultimately then informs intervention, feasibility, evaluation, and implementation, the second stream of my work. So these 2 streams are really iterative and operate hand in hand, focusing on the causes and then how we use our understanding of the causes to understand interventions and to actually implement and evaluate those. But academia, as we know, operates within a publish or perish model. And so oftentimes there is increasing pressure to produce and produce and produce, and that doesn't always lead to the most meaningful work. And I want to walk you through how I got to where I am today and how I operate within the system that ultimately does reward publishing and publishing quickly and in high impact journals, and talk about how I work within this model to try to have meaningful impacts. So I'm from Winnipeg, and I did my undergrad in psychology and philosophy at the University of Manitoba because I was really interested in human behavior. That was ultimately the interest that has motivated me the most, quite frankly. It's a pretty broad interest, and I didn't know exactly what to do with it. So naturally, like someone who was interested in school and humans, I thought law school was the right answer for me. So my plan after undergrad was to go to law school, but being from Winnipeg and having done my undergrad there, I had never lived outside of Winnipeg, let alone the country, and I wanted to have an international experience. So I decided to do a 1 year master's abroad before buckling down for law school. And thinking about where to go, the Rhodes Scholarship seemed like a really appealing opportunity, and I decided to apply. And in putting together an application, I found out about this program at Oxford called Evidence-Based Social Intervention and was really intrigued by this. The idea behind it was that we should be studying the interventions we implement before we actually go forward with wide-scale implementation because interventions can have harmful effects, or at best, if not having positive impacts, they can be a waste of resources. That was a really compelling idea to me because in psychology, my experience had really been that research stays in the ivory tower and doesn't move beyond into policy and practice. So I wanted to learn more about that. Unfortunately, I was not successful in getting a Rhodes Scholarship, but I became really interested in this master's program and I decided to apply anyways. I got in and then I had to find alternative funding. I did. I was successful in doing that. So I went off and I did a master's in evidence-based social intervention at Oxford. In doing this research, I really got unparalleled exposure to action-oriented research that was actually having a direct impact on policy and practice. So for during my master's degree, I focused on health outcomes among HIV-affected children in South Africa on a team that was collaborating with UNICEF, WHO, the South African government. My work was focused around respiratory outcomes and in particular asthma and how household stress and community stress contributed to that. And in particular, I looked at how child abuse and neighborhood violence increased the severity of asthma symptoms and prevented children from getting appropriate access to asthma treatment. And this was a really uh, sort of momentous experience in my life to see how research could have this impact on policy and practice. And it really led me to question, should I go ahead with my law degree, or does research possibly have more of an impactful role in policy and practice than I had initially realized? So I was left with this sort of quandary. Do I go to law school or should I actually continue in this field and go on to research? And so I applied for the Rhodes Scholarship again. It was my last chance. I was at the maximum age that I could be to receive the scholarship. And that time, as I put in my application, I met with a variety of different people across academia and law. And one conversation with a human rights lawyer who has an incredible career really stuck out to me. And it was that he told me about how he didn't end up in his career till he was in his 30s. And rather than thinking about where he wanted to end up at the end, he just kept doing what interested him the most. So his advice was to me was just keep doing what interests you. I thought about it. I thought about it. And I thought, a PhD seems more interesting than a law degree. I think I would probably end up in a similar career either way. So maybe I should go ahead with the PhD. And at the same time, I was successful in getting a Rhodes Scholarship on my second time. And so it was a done deal for me. And I went off to Oxford, back to my department, and completed a PhD that I finished in 2019. Now, in my master's, I had focused on respiratory outcomes, but I was really looking at how violence at different levels predicted health outcomes. And I found myself much more interested in the violence aspect rather than the respiratory health aspect. So I pivoted, and in my PhD, I focused specifically on the most common form of violence against women, intimate partner violence. I conducted a systematic review on the risk and protective factors for IPV among women, and in particular, I focused on longitudinal studies because at that point, the literature had been really focused on cross-sectional studies, so studies conducted at a single point in time, which really limits our understanding of what might cause this violence and ultimately what can inform prevention, which is really where I was interested. I found that in these studies that followed people over time, the vast majority were focused on individual or relationship level factors like relationship satisfaction, as opposed to community or structural level factors, which is really what I was interested in and has shown the most evidence in being able to have large impacts on population level outcomes. So ultimately, this evidence base is really focused on targeting those intermediary determinants of violence, leaving the structural determinants unattended to, and as a result, would ultimately lead to persistent inequities in violence. So in my PhD research, I then focused on the relationship between neighborhood disadvantage and in particular, long-term neighborhood disadvantage and how it can increase the risk of violence against women. And I conducted a series of studies as well as knowledge translation pieces around this really pivotal relationship that ultimately informs how economic redistributive policies and neighborhood regeneration policies could have an impact on improving intimate partner violence outcomes. I also, at the same time, worked for a charity throughout my PhD, the Oxfordshire Domestic Abuse Charity, County Services, where I was working frontline on supporting clients and really getting to see firsthand both the common backgrounds from which our clients were coming from and the challenges that this produced for them in terms of successfully moving on from abusive situations and accessing services. And at the same time, the really significant challenges that the organization was facing in terms of chronic underfunding and a lack of support. And that really has motivated my research to this day in terms of understanding the challenges that frontline workers face and the undervaluing of the anti-violence sector. So following my PhD, I transitioned to back to Canada, where I conducted a postdoc in social epidemiology at the Center for Urban Health Solutions at St. Mike's Hospital and U of T's School of Public Health. And in particular, I was funded by the CIHR Health System Impact Fellowships, which has been a really pivotal funding stream to support embedded research within health systems. And I just want to sort of highlight how my postdoc research has transitioned into my research program today. During my postdoc, the COVID-19 pandemic hit, and I had to pivot what I was focusing on in light of the pausing of all research. My office turned into a COVID-19 assessment center. And I wanted to understand, like many VAW researchers, how the pandemic was impacting survivors. And working in partnership with the anti-violence sector in the Greater Toronto Area, we conducted a community-partnered study called the Marco VAW study, the Marginalization and COVID-19 study, focused around violence against women. As we were carrying out the study, we received interest across the province in expanding the learnings we were generating from Toronto across the province to work with other provincial organizations. At the same time, I took up my position at Dalhousie, and there was interest in expanding our work not just across Ontario, but into Atlantic Canada. And that was the start of the Interprovincial Violence Against Women Project, or the IPV project, where we have been studying for the last 4 years how have health and social services adapted to the COVID-19 pandemic and the current context, and how well are those services meeting survivors' needs. In generating this knowledge, we've now moved into an action-oriented component of the program, which is focused around how we can strengthen the health system response to domestic and sexualized violence as the most common forms of violence against women. And here we are working in partnership with health organizations, as well as our social service and community partners, to improve intervention and response strategies to patients experiencing violence. So we do produce our academic outputs that are needed and really actually play a very pivotal role in advocacy. Peer-reviewed literature is treated differently in policy and practice than non-peer-reviewed literature. So we do follow this model, but a critical component of being able to work in partnership with organizations is getting the information out fast. And to do this, we also, often before the peer review publication, produce lay reports and infographic summaries to go alongside the information and ensure that our partners have information in hand to be able to advocate the changes that need to happen in order to improve violence responses. And of course, all of this work has to be done in partnership with those on the ground. And so that has led us to create a partnership to support all of our work, all of our projects that really continues to grow. And it actually now includes many more organizations than I can even list on this slide. So to close off, I just want to highlight that embedded and action-oriented research, especially when working with marginalized population, does require additional time, resources, and efforts that are not always rewarded by academia. But it is one of the most important ways to ensure that our research has impact. And in doing this work, flexibility from researchers and meaningful partnerships is absolutely critical and has to happen in order to be successful and to actually see an impact. What I would say to you, what I've learned from my windy road so far, is that it's important to continually ask yourself, is this what interests me? And is this in line with my vision and mission? So, whenever you reach a fork in the road, I think these questions are really important guiding questions. But also, I think they're important questions to reflect on as you are pursuing whatever project or degree is at hand, to really think about, am I focusing on what I should be focusing on? For me, that guiding mission is that violence is not inevitable and we can prevent it and we can reduce the inequities that it creates. And so throughout my work, I'm constantly asking myself, am I continuing to move that mission forward? And if not, it's time for me to pivot and move on. So I'll end it there. Thank you. And if you'd like to reach out beyond this, please feel free to reach out to my personal email. Thank you.